Somniphobia, or the fear of sleep, is something that some people definitely experience. Now, there can be a few things, or actually many things, that can lead to that fear of sleep. First thing I always want to stress is that somniphobia in and of itself is not actually a sleep disorder. It's not something that we would diagnose someone for. So we have to think about what are some of the things that could lead to somniphobia, first and foremost. The number one thing that we often think about would be something like post-traumatic stress disorder. So if you're someone who's had any sort of trauma, if you've experienced trauma yourself, you've witnessed trauma, there are things that you really want to think about and talk with a doctor about, because we have really effective treatments for PTSD for many people. If that post-traumatic stress disorder is influencing your ability to fall asleep, stay asleep, or even go to sleep in general, and you're fearing getting in your bed, definitely talk with a doctor, a psychiatrist, a psychologist, because we need to get that treated. There's some other things that we often think about too. So anxiety. Some people don't want to go to bed at night because they don't want to be with their thoughts. Same thing for depression. So if you're avoiding going to bed at night because you don't want to ruminate, you don't want to think about your thoughts, be with your thoughts in the quiet, definitely talk with a psychiatrist or psychologist to get treatment for that. Nightmares are another thing that we frequently see can lead to somniphobia for some people. So some people might find that they're just scared of going to bed because they don't want to wake up and have nightmares. They just don't know what the night is going to bring. Nightmares should not be ignored, especially if it is leading to you avoiding sleep or fearful of sleep, or even like white knuckling going to bed at night because you're just anxious about potentially having nightmares. Nightmares can be due to many things. It can be due to poor sleep quality, it can be due to apnea, irregular sleep-wake timing. Sometimes even things like melatonin can lead to nightmares. We want to get nightmares treated. So see a knowledgeable board-certified sleep specialist, because we actually do have really good treatments to help with nightmares. You should not fear sleep because of nightmares. Now, other things that can lead to fear of sleep could be safety at night. If you live in an area where you just don't feel safe to go to sleep at night, we encourage you to talk with a sleep doctor to help problem solve, trying to feel as safe as possible in the environment that you have. Somniphobia can lead to bigger issues long-term with the sleep deprivation that it causes. Don't ignore it. If you notice it happening for a week or two and it's just not getting better, talk with a doctor.